say a few words to pay tribute to the folks in Nova Scotia, particularly the family, the loved ones of the 22 fellow Canadians that were tragically killed in a senseless act of violence took place 1 year ago in Nova Scotia. The flag in our Manitoba flag in Memorial Park is going to be at half-mast today to honor and to remember the victims of this tragic event. And I'm sure I speak for all Manitobans when I say that our thoughts and our prayers are with Premier Rankin today and all the folks of Nova Scotia on this solemn day. Year to date, Manitoba has enjoyed the lowest COVID transmission outside of Atlantic Canada, and that is a tribute to the people of Manitoba who have successfully followed public health orders and done the right things to bend the COVID curve. We've had and we've maintained some of the most strict restrictions in the country, including very, very strict travel rules, as Manitobans know, and as visitors to our province know as well, and the most careful and I would say cautious reopening in the country. And these measures have worked because Manitobans have worked at them. We don't want to go back to where we were before, obviously, and so we know that the days of COVID beating us were hard days for all of us, and most certainly we don't want to go back to COVID beating us. Cela a fonctionné parce que les Manitobains l'ont fait fonctionner. Nous ne voulons pas retourner là où nous étions auparavant lorsque COVID nous battait au lieu de battre COVID. Despite our best collective efforts, however, COVID is on the rise again due to, in large part, the new variants of concern. Our cases are rising. Our test positivity numbers are rising. Hospitalization numbers are beginning to go back up. We've been in this situation last year, and we know that we don't want it to be recreated now. Variants of concern are demonstrative of the skill that COVID has in adaptation. We need to be more skilled than COVID when it comes to adaptation. COVID transmission is faster because of variants of concern. These variants of concern will make you sick, and they are dangerous. They are swift and dangerous in attacking human beings. We cannot stand by and wait for what happened once to happen once more, as we're seeing across much of the country now. Vaccines are coming, but they are not yet here. And we have at least another 2 months ahead of us before the supply that the federal government is responsible for sending us meets our needs. That's the reality of COVID in Canada today. The variants of concern are here, but the vaccines in large part are not yet here. So we must remain diligent. We must remain cautious. Caution must be our guide, and caution is our guide. We must be cautious, all of us, in our attitudes towards COVID-19. We must be proactive in our action to counter COVID-19, and that's why today we are announcing new public health restrictions that are necessary to protect and safeguard Manitoba lives. C'est pourquoi aujourd'hui nous annonçons de nouvelles restrictions de santé publique nécessaires pour protéger et sauvegarder la vie au Manitoba. As virtually every jurisdiction to the east and west of Manitoba grapples with the third wave of this pandemic and the significant challenges that are posed by COVID-19 variants of concern, our public health officials, Dr. Roussin, Dr. Reimer, Dr. Anderson, Dr. Atwell, their teams have warned all of us that Manitoba could face these same challenges. Manitoba has been an oasis. It's been a refuge, green in a desert of COVID for the most part through 2021 compared to our neighboring provinces. But I would emphasize to everyone that we are, of course, not an island here. COVID ultimately knows no boundaries. We must act swiftly to protect Manitobans, and we must act swiftly to protect our healthcare system. Despite having some of the most strict public health orders in the past few months, our case numbers over the past week have begun to increase, along with rising test positivity rates, not to the level of other jurisdictions across the country at this point in time, but there is a strong, strong signal that there is a third wave beginning here, as it has throughout the rest of the country and around the world. So today, Dr. Roussin and I are here to announce immediate adjustments to our current public health orders, adjustments which we hope will succeed in slowing the speed of the third wave and avoid a return to a full shutdown in sectors of our economy, which is something I think we all want to avoid. At this point in time, it's crucial to limit our gatherings and our close contacts. That is key, particularly indoors, in order to address the increasing transmission rates we're seeing, especially with the variants of concern. With that, I'll pass it over to Dr. Roussin to expand on the new restrictions. Over to you, Brent.
Thank you, Mr. Premier. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. We have no new deaths to report today related to COVID-19. The current 5-day COVID test positivity rate is 5.7%, both provincially and in Winnipeg. 108 new cases of the virus have been identified as of this morning, bringing our total number of lab-confirmed cases to 36,267. We've been monitoring our numbers and epidemiology over the last number of weeks. We've seen some concerning trends. Our contact tracers are reporting that cases are having growing number of contacts. They are reporting individuals holding larger group gatherings, both indoor and outdoor, house parties, play dates, sleepovers, including people from other households. We've seen clusters linked to large funerals and other gatherings. We're seeing more cases linked to long-term care homes and schools. And we've seen at least one cluster linked to spring break travel. Our test positivity rate has been consistently climbing. It's up nearly 2% in the last 3 weeks. We're starting to see higher case numbers in many cohorts, in many of the younger cohorts, the teens, 20s, 30s, and 40s. We're seeing an increasing proportion of admitted cases requiring ICU admission. And this is consistent with what we're seeing in other jurisdictions with the B117 variant. In Winnipeg, recent cases are showing roughly 2/3 of our cases in Winnipeg are related to the variant of concern. So all of these indicators, combined with the increase in the variant of concern and what we're seeing in other jurisdictions, tells us that we are now in our third wave. So we need to introduce these new measures to help slow the transmission of the virus. We will see what is happening in other jurisdictions. We need to ensure we can do whatever we can here in Manitoba to keep that from happening here, while at the same time we're vaccinating our population. So as of midnight tonight, we're making changes to gathering sizes. So this includes a return to allowing only 2 designated individuals per household, again with certain exceptions. We're limiting outdoor gatherings on public and private property to 10 people maximum, and that includes the same household in that count. We are reducing capacity at faith-based and cultural gatherings to 25% or 50 people, whichever is smaller. The mask rules that we previously had in the faith-based gatherings will remain unchanged. You're still required to wear a mask at all times other than when seated and not singing. Wedding and funeral group sizes are again reduced to 10. There's in addition to a photographer and an officiant. In addition, orders affecting retail locations and malls will come into effect as of midnight on Wednesday. Wanted to give just a little bit more time for the businesses to apply this. The capacity limits will reduce from 50% capacity or a maximum of 500 patrons to 1/3 capacity or a maximum of 333 patrons, whichever is lower. And those will be in effect, these orders will be in effect until May 12. So we really just have to look to the provinces on either side of us to know why we need to make these adjustments at this point. We've been here in this place before. We've been here in October and November, and we saw where that could get us. We're now dealing with a virus that transmits easier and is even more severe, requiring more hospital admissions, more ICU admissions. So we need to stay home as much as possible. If you do leave the house, ensure you're taking all those measures, the fundamentals that we've talked so much about: washing your hands, certainly staying home when you're ill, physical distancing. We want to wear a mask in all indoor public places. Certainly transmission is less risky in outdoor settings, and so I encourage people to be outdoors. But if you are outdoors and gathering with people outside your household and you're unable to distance, that's when you should have a mask on. Again, staying home when you're ill, seek immediate testing if you have even mild symptoms. We've seen our contact tracers mentioning cases to us where there's a sick household member who's has not gone for testing, but other members of that household are going to work or going to school. And sometimes this is a lengthy period of time when no one's getting tested, and then we saw clusters develop that way. We wanted that person to be tested as soon as possible when they had symptoms, and that whole household to isolate pending results. But instead, we've seen a number of examples of those households going out and about and leading to clusters. So we do have more tools in our toolkit than we did in the second wave. We have broader testing, and we have vaccine right now, and we're going to be accelerating that as soon as the supply allows us to. But we still need to work together to keep these numbers down while that vaccine rolls out. So again, we have lots of reasons to be optimistic for the summer approaching, when we have much more vaccine on its way. But right now we have to avert a very large third wave like we're seeing in other jurisdictions. So thanks again to Manitobans, and I'm going to turn it back over to the Premier.
Thanks very much, Dr. Roussin. As Manitobans know, we have been, as a government, working with Manitobans. We'll continue to work with Manitobans side by side. And included in that, of course, our Manitoba business community, our small businesses, have received the strongest supports of any Canadian province throughout this pandemic, and we continue to want to do everything we can to help those businesses do what they do best: employ our fellow Manitobans and provide us with the goods and services we rely on. We want to make sure that we take the necessary steps to avoid any necessity to move backward again with a more full shutdown. To do that, we need the help of all Manitobans to do as Dr. Roussin and others have advised, to follow those public health orders, to be diligent, to be careful. Today as well, I want to announce a new rapid testing partnership with Manitoba businesses and our critical services sector that's going to help to further limit the spread of COVID-19 through early asymptomatic testing. We're also going to make vaccines available to more people faster. Manitoba's Vaccine Task Force, which will be reporting to you in a couple of days again, has announced they're making the Astrazeneca vaccine available to all persons age 40 and up through our medical and pharmaceutical partners, and that will assist as well. Previously, it was restricted only to older Manitobans, but now will be available to everyone 40 and up. As more vaccines become available from the federal government, we'll continue to ramp up our planned capacity to vaccinate as many Manitobans as quickly and as safely as possible. Currently, we have 5 vaccine super sites in operation: in Winnipeg at the RBC Convention Centre, in Brandon, Thompson, Selkirk, and Morden, with 2 additional sites, one in Northwest Winnipeg, one in Steinbach, that'll be set to open in the coming weeks. Additionally, beginning today, pop-up sites are scheduled for a number of communities throughout the province. For a list of those, visit manitoba.ca/COVID-19/vaccine/clinics. That's manitoba.ca/COVID-19/vaccine/clinics. We continue to bolster our enforcement efforts as well to enhance inspections and the visibility of our inspectors. And I encourage all Manitobans to encourage our inspectors in their work. It's not easy work to do. And I know that there have been a couple of incidents at least of some overt disrespect for the folks that are out there doing their job, trying to help us stay safe. So please encourage those inspectors, when you see them out there doing their job, please encourage them in their work, because it's important work. Working in conjunction with our partners, we've implemented a more intensive inspection cycle with an emphasis on targeted enforcement to ensure that information about Manitoba's public health orders and self-isolation requirements is out there and available at various points of entry as well. We've got trained licensed security personnel from Commissionaires Manitoba that are now engaged in greeting travelers arriving at the Winnipeg International Airport to advise on our self-isolation requirements, to distribute public health materials, to answer basic questions about public health orders. These are measures to step up the enforcement that sadly is necessary because of the fact that some people need to get the message more directly than most of you who've already acted on these messages and are doing so. So I thank you for doing that, but I want you to know that we take the enforcement of these health orders seriously. This is a critical point in Canada's fight against COVID-19, and Manitoba has a long and proud record of doing our best to help our neighbours in times of need. We led both wars in volunteering for service, for example. We are the leading donors to charities. We're the leading volunteers for worthy causes, and so we want to do what we can to assist Ontarians at this time, although, of course, like all provinces, our health system is under great stress too. As a first step, I wanted to emphasize, and we will be emphasizing to Premier Ford, that pre-existing relationships that our health department has with Northwest Ontario folks to make sure that we can care for those patients that are in real danger with an immediate threat to life will be strengthened, and we're offering, of course, to continue and strengthen that relationship that existed before COVID and now is especially important during COVID. In addition, we have issued a call to action to invite retired health officials, including nurses, and those with ICU experience, to assist them if they would like to help in Ontario by way of facilitating their re-registration, and I know that Ontario would welcome any assistance and has asked for assistance during the dark days of this third wave. In addition, we are in dialogue with the Government of Ontario to see what additional equipment may be available to them. We have some ventilators, for example, that would become that will come in handy, I know, in their situation right now. We have strong reserves of PPE thanks to great partnerships we established with Manitoba, mostly Manitoba manufacturers and providers. And we have other health needed equipment in surplus that we may be able to make available to Ontario should they desire it. So that dialogue with our health department and theirs is underway. I wanted Manitobans to know that we are doing what we can in these difficult times to assist our neighbours and friends in Ontario. We all have a role to play in protecting ourselves, our loved ones, and our community. The level of caution has to remain high. I will repeat, as Dr. Roussin has said, and as we are fond of doing, that it is really important to play defense now. Really important to stick to the fundamentals. Limit your risks. Avoid close contact settings, crowded places, closed spaces. And I'll say this especially to those like me who have been fortunate enough to have their vaccine. Don't take chances just because you have that vaccine. This is not the time. We have to follow these health orders. We have to be very diligent about it. Set an example for everyone else in your family who's younger, for example, and hasn't had a chance to get the vaccine yet. Make sure that they are following the orders just the way they're seeing you do. Wash your hands. Stay home when you're sick. When any member of your family is ill, wear a mask. Limit your close contacts. And most of all, stay positive. Be kind. I know today's news is something of a setback for some, and it will be taken as a move that is unnecessary given our lower numbers at this point, but this is a move that's based on foresight that should teach us, if we've learned anything from last year, that we are not the same people and cannot be the same people we were last year. We have to follow these public health orders. We must, we will, and I'm confident in Manitobans they'll continue to be successful in bending that COVID curve. Together we can beat this thing. Thank you. Look forward to your questions.
Thank you, Mr. Premier. Thank you, Doctor. Reminder to the reporters on the line, we'll have one question, one follow-up today. We start with CHVN and Taylor.
Hi, good afternoon. Manitobans are tired of COVID. They're confused about all the changes to the health orders, discouraged by not having an end date in sight. How confident are you that this new round of changes will be followed?
Well, I think we're been confident in Manitobans, and the vast majority of Manitobans taking COVID quite seriously. And so we put these orders in now because we see the increasing trends. We see what's happening in other jurisdictions. I think this is a very measured approach to where we are, and noting that we already had fairly stringent public health orders in place. But I think we're at a very important place right now where we need to avert this third wave, and I really think that these orders right here are our last chance to flatten our curve here in a third wave before we will have to revert back to more stringent public health restrictions.
I know that we're seeing vaccines starting for people in their 40s. Will we and when will we see those public health orders change to reflect this, or even having health orders for those who are vaccinated and those who are not?
Yeah, and so I do think that there's certainly a lot of reason to be optimistic moving forward. All pandemics end, including this one, and so there will be an end to it. As we roll out more and more vaccine, we're going to start seeing the benefits of that, and as we start seeing those benefits, we'll be able to loosen the restrictions moving forward. But it's going to depend on vaccine uptake. It's going to depend on how quickly we receive doses to be able to administer, and really just depend on our numbers.
Up next, the Winnipeg Free Press and Katie May.
Good afternoon. Premier Pallister, you've spoken about the first steps Manitoba is going to take to meet Ontario's request for nurses and medical staff, but we know Manitoba already has a nursing shortage and acute care teams here are already stretched thin. So what are we going to do to strengthen our own healthcare workforce during this third wave?
Well, we've already taken significant steps in that direction, Katie, and we'll continue to do that, but I don't think it's fair to disregard the needs of a neighbor at any time, and so I believe these are reasonable efforts that we're making to try to endeavor to help, and that is the Manitoba tradition after all, so we'll continue to make those efforts.
A question for one or both of you. Given what we know about the variants of concern and the pace of the vaccine rollout, as well as what we're seeing happening in our neighboring provinces, why is Manitoba not entering into a lockdown now?
Well, we had significant restrictions in place as of now, so we've bolstered them with this. We see that our numbers are climbing, so we needed to do more. I think this is a measured response right now, but I do think from a public health perspective, this really is our last shot at reducing our numbers before we do need to move into more of a lockdown scenario. We cannot overwhelm our healthcare system. And so we are at risk of that if our numbers continue to climb at the pace they are. So this is our chance right now to change that trajectory.
I think it's a fair observation too, Katie, that Manitobans have avoided a lockdown in large part because of two things. One, because of the more stringent restrictions that we maintain than virtually anyone outside of Atlantic bubble. and two, because Manitobans followed those restrictions and they've effectively bent the curve down, even with the upswing in numbers over the last few days since the spring break and Easter and Passover break. They don't remotely approach, they're fractional compared to other provinces right from Quebec right to the West Coast. So Manitobans don't deserve a lockdown because Manitobans did the right things, but they do deserve to have a long-term sense that we're moving in the right direction. And I think of this as a journey. I've said many times it's not a sprint, it's a marathon. It's proving to be a very long marathon for all of us. But that being said, on any journey there's some speed zones, and right now I guess we're going to slow down a little, like imagine it like a school zone. We're going to go a little slower for a time here, and our restrictions are going to result in some pullback. But that's necessary to get this safely to the end of the journey. So today is, as I've said several times in the past few months, there will be good days and days that aren't so good. Today isn't as good, but we've had good days and we've kept our restrictions largely in place. And I think we'll have many more good days in the future because Manitobans are following those restrictions.
Up next from Global, Merrick.
Hi there. I'm just wondering, was there any consideration, and if so, why wasn't masks, mandated in this set of restrictions outdoors in public areas, or not, just outdoors in general?
Yeah, and so the messaging here is that transmission is much less likely outdoors. So we want to encourage being outdoors rather than really high-risk transmission settings, which is indoor, crowded, closed spaces. But the messaging is clear that if you are outdoors, if you're gathering with people outside of your household and you're unable to distance, then you should have a mask on. But we just didn't put that into the as a mandate. We didn't want that as a distraction. We do want people outdoors, but the messaging, if you can't distance outdoors, you should have a mask on as well.
So with that said, moving into indoors, why are people still allowed to take their masks off at church?
Well, we have very strict capacity limits in churches right now, and we've just made them even more strict. So masks are required at all times other than when seated, and you can only be seated with your household members and then some distancing in there. So, the public health advice is if you're indoors, wear a mask. But the orders do allow for that exemption in some scenarios. My advice is to wear a mask at all times when you're indoors. And then just like we talked about with outdoors, if you're outdoors, gathering with people outside of your household, unable to distance, you should have a mask on as well.
From the Brandon Sun, Kim.
Good afternoon. My question is, the Canadian National Advisory Committee on Immunization advised use of the Astrazeneca vaccine in people 55 and over. And my question is, how are you justifying the use of the Astrazeneca vaccine in people under 55?
Yeah, so this is largely based on risk assessments, benefit risk assessments. And so if we look at the what we've learned more and more about the blood clot issue with AstraZeneca, how rare it is, and how what the risk of transmission of COVID is, the benefit far outweighs the risk for those that are 40 and above, especially where we're seeing active transmission of the virus. So we made that decision that the benefit is going to outweigh the risk here in Manitoba, and certainly everyone will make their own informed choice on whether to be vaccinated, but my advice is to be vaccinated as soon as you can and be vaccinated with whichever vaccine you're offered.
Thank you. My second question is, will the province be releasing information on the symptoms of blood clots, seeing as we are going to be releasing the vaccine to people under 55?
Yes, we do. We do have that. We've previously communicated that, and that's certainly available online. And so the symptoms that we would be concerned about are, severe headaches, chest pain, shortness of breath, these type of issues. And so certainly can, really if you have those symptoms, chest pain, shortness of breath, you should be seeing getting medical advice anyways. But yes, we do have that messaged, and we'll continue to message the symptoms to look for.
Up next from CJOB, Skylar.
Dr. Roussin, Premier Pallister, thanks so much for your time this afternoon. I'm going to read a short tweet verbatim to you both that I've received in response to my live tweet thread of this conference. This comes from a man who says, quote, "Most rural people will not be following these rules since we've reached peak COVID fatigue." I'm just wondering what either of you would say to that.
I would say COVID's gotten a lot smarter. The variants are evidence of that, and we need to get smarter along with it.
Thank you for that. My second question is why the decision to maintain an allowance for outdoor dining with members of outside of your household? You just said COVID's got a lot smarter. We know that prolonged maskless contact can lead to more spread of the virus, even though they're outdoors. So why did we maintain the status quo there?
Well, I think a lot of it is that balance. We know outdoors is much less risky. We know we've had restrictions in place for quite some time here in Manitoba. And so we're looking at the most risky situations. We're looking at situations where we're seeing a lot of transmission right now. And so the decision was to continue with that allowance, but we'll be watching it quite closely. I think that we need Manitobans to follow the fundamentals. Certainly not be going out when you're ill. Limiting our contacts outside our household. So again, there are things in the orders that are allowed, but we all have to make our choice now to limit the amount of contacts we have outside of our household. Certainly do that when we're indoors. Outdoors is much less risky. But following those fundamentals, and really this is our opportunity to bring down these numbers without having to go into further closures.
From the Winnipeg Sun, Josh.
Good afternoon, Premier and Dr. Roussin. On Friday, Dr. Atwell said that they weren't putting the new orders in place because they wanted to give Manitobans an opportunity to show that they could follow fundamentals, follow these health orders currently in place. What changed over the weekend? Did you notice a big spike where it was too much to just kind of rely on no change, or to rely on Manitobans to continue to follow those orders? Why? And is there any, I guess, kind of revisionist looking where maybe these health orders should have been in place before the weekend?
I don't think anything dramatically changed over the weekend. We've been following the trends. We see that the proportion of variant of concern cases has been climbing. We had looked at at these type of restrictions last week, and looking at the timing of that, again, considering when we would announce it, when we would have them in place. So I think that this is proactive, that we're at the early stages of our third wave, so we wanted to make a change. And we decided to just make the announcement today and have some of them come into force at midnight tonight, and then the rest on Wednesday.
Okay, and you mentioned there was a cohort of cases of variants over the summer, or over the spring break. Excuse me. The uptick that we're seeing now, because we're now 2 weeks since Easter, is this related directly to Easter, or is this just more spread, easier spread from the cases of variants of concern? And can you really tell the difference between this is because people gathering over Easter, and this is just because the variants of concern are easier to transmit?
Yeah, so it's a bit of both. We see other jurisdictions, once that variant of concern reached certain levels, we saw the transmissions rise dramatically, and that's what we're starting to see here in our third wave. Our contact tracers have notified us of a number of cases that are linked to gatherings over the holiday weekend, large family gatherings, multiple households. We've seen travel from spring break. We've seen a number of settings where transmission has occurred. So it's we know transmission will increase when people increase the amount of contacts they have outside their household. And we also know that this variant of concern is much more easily transmissible, and so we're going to see case numbers rise because of that.
There's an added danger too, Josh, because of the fact that we've been, relatively speaking, an oasis, that may lead to the wrong behaviors. That may lead to people being complacent about the health orders. That in combination with the reports about vaccines coming but not yet here in most part, is a dangerous combination, and then throw in the variants into the mix and you see what we're talking about here. There's a real reason for concern that combination of factors could equate to a real upswing potentially in close contacts, in dangerous contacts, in transmissions, and therefore in hospitalizations, ICU needs, and so on. So these are cautious moves. They're done out of an abundance of caution. They're done to protect the guy who wants to not abide by any rules sooner. So if you want to get away from these rules, then follow the rules now, because if you don't, they're going to be here longer, unfortunately. So it's about being disciplined. It's about being careful. It's about being cautious. It's about playing defense, and that's how we win against COVID, because it's sure playing offense against us.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin and the Premier. My question, I guess, is for Premier Pallister. It seems that the border it is not closed between Manitoba and Ontario. So Manitobans cannot go to Ontario, but Ontarians can come to Manitoba. Why Manitoba isn't closing its border with Ontario?
Well, because we want to make sure that we're continuing to take the necessary measures to protect Manitobans, and right now keeping Ontarians from Northwest Ontario out of Manitoba isn't on the top of the list.
Thank you very much. And my next question is for Dr. Roussin, I guess. Just a reminder, I know that you've talked about this a lot, but can you give us an update about schools? What are the protocols when a student is tested positive for COVID-19 in schools?
Yeah, so if we have a positive test that's reported to public health, we'll obviously contact that individual and their guardians, depending on the circumstances. If we determine that they were infectious at any point while in school, then we work with the school to identify contacts. And so depending on the situation, there might be no contacts if things were followed quite well and we were sure about that. Or it could lead to an entire cohort needing to be isolated. So it really depends on the public health investigation. But the key to this is staying home when ill, staying home when any member of your family is ill, getting tested as soon as symptoms develop, and then public health can then find cases earlier and isolate those who need to isolate earlier.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. So as of now, our 7-day average case number is 137 cases per day, just down one based on the low number today. But where, if we didn't put in these new restrictions that we're putting in, where would we be on a 7-day average case number per day in 2 weeks and in 4 weeks?
Yeah, so it's obviously going to be a range on that, but we know with this variant of concern, it's much more transmissible. We saw the very rapid escalation in cases in other jurisdictions. So what we saw in the early stages of the second wave was roughly about a 50% per week growth. And so we were expecting at least that and probably significantly more than that over the next couple of weeks if we don't do anything to change that transmission cycle.
Thank you very much for that. Mr. Premier, similar to Mohammed's question, last year in late March and into April, there were those informational barricades on Highway 1 and Highway 16 at the borders. The borders weren't closed, but drivers were stopped to give information, and now we have interprovincial quarantine. So why not put that back again, just to discourage the handful of non-essential travelers who might be thinking of just skirting around the rules here?
Well, I can only say that we already have the most restrictive travel rules outside of the Atlantic bubble in Canada. And I think that moving to more travel restrictions would be lower on the priority list, and as evidenced by today's restriction changes, than would be trying to reduce the number of close personal contacts in households, for example, or in confined spaces. So we're not seeing this as an issue of high priority. In Ontario, they have another challenge entirely, as you know, multiple levels of cases, variants of concern in abundance and multiplying rapidly, and so every step that they have had to take has been designed to address their situation. Our steps are designed to address ours.
From the Canadian Press, Steve.
Oh, hi there. Premier, I would just like a few comments from you on the vaccine distribution system to date. We've seen the numbers sort of creep up, especially in the pharmacy and medical office branch of things. Now that the eligibility for Astrazeneca has expanded, that's expected to go down. But are you looking at any changes to that distribution model, given the fact that once you open a vial of Astrazeneca, all 10 doses there have to be used within 48 hours?
Yeah, it's a good question to ask the vaccine team on Wednesday. I just want to say thank you to everyone, Brent's office, and he personally, I've thanked already, but I think it's important to understand that the Vaccine Implementation Task Force has been working its tail off right from the get-go, way back, and that, you know, I know from my days as a pitcher, everybody in the stands could do it better than I could, but I was the one that had the ball and had to throw it. They've had to make all kinds of calls and decisions. I know that there's been a lot of question about the effectiveness of getting the vaccines out. I want to address that today and say again, our vaccine team is more concerned and has been more concerned with getting needles in arms than they have been with getting data back entered. So our data entry process has lagged, and that makes it look like Manitoba's slower than it is on getting vaccines out. The other thing is also we have the highest percentage of vaccines going to our remote communities. And so we don't enter our data the way others do. We wait until we have confirmation that vaccines that have gone to our northern communities have actually been given to people. And so because of that, you know, we're 1.2%, I think, today behind Alberta and 2% behind BC. But that being said, that is because of data entry, not because of a lack of effort on the part of our vaccine team. So thanks to them again for their tremendous work. Thanks to the close to 2,000 folks that are involved in getting these vaccines out. And I'm excited, and I think Manitobans are excited about the pop-up clinics, about the new super sites that are going up around the province. We're going to have a couple more big ones going here in the next 2 weeks. It's exciting. We just need more vaccines. The capacity is there to get them out, and I know that Manitobans want to get them as soon as possible.
And Dr. Roussin, we're seeing reports here and there of cases in schools, and I noticed that up in Gimli, three of the schools are closed today because of some cases. And I don't want to, overstate the extent of potential exposures, but are you seeing a rise in cases in schools in recent weeks? And if so, would that be due to new variants or some other factor?
We're definitely seeing increasing growth in those younger cohorts, that 10 to 19 age cohort, and so that will mean that we'll find more cases that have been in school as well. So what we're finding is, like we've seen before, there certainly is transmission that occurs there, but the most of the transmission in that cohort is occurring outside of schools. Gatherings with friends, sleepovers, house parties. these type of things. So we are concerned about the increasing transmission in those cohorts, because we do know, just like our second wave started in the younger cohorts, once you see widespread transmission anywhere, it's eventually going to be everywhere. So we need everyone on board with these measures, with the fundamentals. This is our chance.
From CTV, Jeff.
Hello, gentlemen. Jeff Keel, CTV. I wanted to ask a specific question, about the measures. Last week, Dr. Roussin, yourself and Dr. Atwell both pointed to, travel and gatherings, and you're talking about it again today as why we've seen an increase in numbers. So why not go back to household only? Why still allow designated visitors?
And I think this goes back again to, to our balance. So we see, like we heard, there's certainly fatigue. We've been at this for a long time. And so we need to reduce the risk, but we need to do it in a manner that we can rely on Manitobans to follow. And so all of these things are based on that balance to try to find where we can reduce the risk the most. But we need Manitobans on board. So we're going to follow these numbers. Like I've said, this is really our last chance before we do have to go back to those much more restrictive measures. So we're going to be relying on Manitobans.
And then retail's going to 33%. Restaurants and lounges are, I guess, staying the same. Can you explain that?
Yeah, and that goes back to the strict restrictions they already have in place. So they're staying the same, but again, to sit at the same table indoors, you have to be in the same household. So this is quite a restrictive place already. And so we didn't feel that capacity restrictions on top of that or any further are necessary if everyone is following what we need them to do. So indoors dining is household members only at the same table.
And closing things off today from City TV, Jonas.
Good afternoon, folks. Dr. Roussin, first question for you this afternoon. Today, with the lowering of the Astrazeneca eligibility to 40 plus, I can't help but look at this as concerning, based on the inability of those that were eligible or the unwillingness of them to get the Astrazeneca vaccine. How much of this is directly related to hesitancy out there and what we're seeing of folks maybe not thinking the AstraZeneca is safe?
So I think we are hearing reports of some hesitancy, especially related to the AstraZeneca COVID vaccine, just from the reports of the blood clots. So what I can say is that with the risk of this third wave, the transmission we're seeing right now, that the risk of having a severe outcome to COVID is far outweighs the very, very rare outcomes of what a very small number of these blood clots are reported throughout the world. So I think we continue to lower our age eligibility at the super sites, and at the same time we're going to go down lower as safely as we can with AstraZeneca. But yes, if following the fundamentals, but also getting vaccinated as soon as possible with whatever vaccine you're eligible for is going to help us lift these restrictions sooner.
And just as a follow-up, sir, I think folks that are now 40 plus have maybe parents in that age range or of the importance of the AstraZeneca vaccine to these folks, to ensure that, if a parent or, has concerns, what can we tell them to get them vaccinated?
I think this is a safe and effective vaccine. It's used worldwide. There's a very small number of these cases. That shows the how great the vaccine vigilance system is, that we can detect this very small signal very early on. We've responded to it, and so we're going to continue to follow things very closely. But right now, at our beginnings of our third wave, our best bet as individuals and as a population is to get vaccinated as soon as we can with whatever vaccine's in front of us.
Winding it up, thanks to everyone for participating today. Thank you to all Manitobans for following the public health orders. This is our 5th anniversary as a government today. Chapter 1 was to fix the finances, repair the services, and rebuild the economy of the province. Chapter 2 was COVID, and Chapter 3 is do it all over again. So we're doing it all over again by doing our best to work together with Manitobans to keep this COVID pandemic down, bend the curve down, and keep it bent down. And I encourage Manitobans to continue to do their part as they have throughout this pandemic. All the best. Thank you. Happy anniversary.